What's up, Everything Medicare Podcast Nation? This is Christian Brindle. Hope you're doing well. This episode will come out on Saturday. So I hope you're having a fantastic Saturday. I hope your weekend is going great, and I hope you had a fantastic week. Every single week, I bring you a podcast where I discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. This is episode 96, folks. So we are closing in on 100 episodes. So thank you for that. Thank you for helping us get to 100 episodes. Because if you weren't listening each and every week on the 3 episodes we do weekly, Monday, Wednesday, and Saturday, there would be no Medicare Podcast episode 96. So thank you for that. For those of you who don't know me, if this is your first time listening, my name is Christian Brindle. I am the host of this podcast, and I own a company called Christian Brindle Insurance Services, where we work with people on Medicare of all different situations. And I'm a Medicare enthusiast. I'm an insurance enthusiast, and I'm an insurance expert professional. Medicare specifically is my specialty. I grew up around this industry. I've been doing it since I was very young, about 20 years old. My dad was an early pioneer for the last 30 years in Utah Medicare, and I work with people in various different locations with various different insurance companies. So, I wanted to give you some updates on some episodes we're going to be coming out with next week, okay? And what to watch for, and you're not going to want to miss these episodes. We've got some dynamite episodes coming, and then we'll jump into the topic today, and that is, if you move, can your Medicare plan move with you? Okay, can it come with you? Can you move that plan with you? And it depending on your situation, so you're not going to want to miss that, so don't go anywhere. So, starting next week, I'm going to be having multiple interviews done, okay? I'm going to be having Justin Brock come back on. Now, for those of you who've been listening for some time, you know we did an interview some time ago, maybe a month or two ago, with Justin Brock. Justin Brock is the Medicare guru, okay? Justin Brock is a very well-known name in the Medicare industry, and Justin's helped tens of thousands, literally, people on Medicare, worked with thousands of agents, and he's incredibly young, and he's just probably one of the most knowledgeable people in the industry today about Medicare, in my personal opinion. So we're going to have him come on again next week, and we're going to be talking about AEP, the annual election period, the Medicare annual enrollment period, and we're going to be doing a whole episode all about AEP and what Justin recommends that you look for, and he said he might have a possible announcement to give. So stay tuned for that. That's going to be a great episode. And we're going to be doing some other episodes as well, so stay tuned for those, okay? So, folks, today, I wanted to talk about moving. For those of you who don't know, I'm someone that's moved across the country twice in my career. I live in Utah. I live just outside of Salt Lake City, a suburb called Harriman. But my office is in Sandy, where I talk to you right now. So, I've moved across the country twice. I moved to Florida years ago, and I did that for a number of different reasons on which I'm not going to get into in this podcast, because this isn't about me and my move, okay? But I moved across the country twice. I lived for a year in Florida, specifically the Tampa Bay market. And for those of you who have listened to me for some time, you know that I've always preached that each market is going to be completely different from one another. Now, there's going to be markets that are going to be more similar to one another when it comes to Medicare Advantage plans and what the benefits look like, who's strong, who's not, as far as insurance companies are concerned, Medicare Part D plans, who's strong, who's not, as far as which company is concerned, and Medicare Supplement, or aka Medigap rates, what the prices are going to be from market to market. They vary. But there's also a lot of things on how things work as far as rules and regulations and what plans are able to do and what they're not able to do, because some of it has to do with the state government, a state-by-state thing, okay? And that state insurance department might have certain rules. So one thing that I learned particularly is When I moved to Florida from Utah, at that point, I had only worked with people in Utah. I hadn't worked with people in all those different states that I do now. Now we work with people in Utah, obviously, Florida, obviously, but also Idaho, Oregon, and we're going to be adding more states as time comes. So please keep an eye out for that and an ear out for that, because I don't like being in only 4 states. I want to be in more because I want to help as many people as I possibly can. But I digress. That's a topic for another podcast. My point is, when we moved to Florida and spent the year in Florida, it was a great educational and learning experience for me at that point in my career, at that young of an age for me. And the reason being is because I had not experienced working with plans and programs at that point in a market such as Florida. And Florida, if you're going to compare the Florida Medicare market to the Utah Medicare market, they're almost like apples and oranges. It's almost like they're two completely different everything from each other. They could not be more different from one another, is what I'm trying to say, as far as what the programs look like, what you need to know, what you don't need to know. And it was a great learning experience for me because it expanded my horizons as an insurance professional. My point is, when you're moving from one market to another, it's vital that you understand that the market you're moving to is most likely not going to be the same as what you're used to in your current market. So I wanted to talk about that and just food for thought. Food for thought on that. So a lot of this depends on what type of plan you have. Okay. So let's first start with Medicare supplements, because this is going to be the easiest thing. What I mean by Medicare supplement or Medigap, because one thing that, I'll never quite understand is every person that's on any type of Medicare plan thinks they're on a Medicare supplement. People think that Medicare Advantage plans are types of Medicare supplements when they could not be further from that. But I'm talking only about Medigap plans or Medicare supplement or Medicare supplement plans, 2 names for the same thing, that are the alphabetic letter plans. Meaning, they're named after letters of the alphabet. Plan F, Plan G, Plan N, Plan K, Plan L, Plan J, if you still have any of those. You kind of get my point. When you move from one state to another, so let's use my example, for example. Let's say I was on Medicare. I'm not. I wish I was, but I'm not. Let's say I was on Medicare, and I moved from Utah to Florida, and I had, let's say, a Plan G with XYZ insurance company, and let's say I'm paying $100 a month and for a Utah rate for XYZ insurance company. This is what will happen. When I move, I will be able to keep my plan. If you have a Medicare supplement or Medigap, you don't have to change your plan. You won't be canceled. The plan will travel with you. It's important for you to know that. However, the premium you're paying, since it's different for, let's say XYZ insurance company is in both states. Let's say they're in Utah and Florida. But in Florida, the prices are double what they are here in Utah, hypothetically speaking. My premium would be adjusted to whatever the price would be in that market. So my premium would raise in this particular scenario. Or if I was going from Florida to Utah, my premium would lower. It would adjust to whatever the rate would be in that state for that particular carrier. Okay? So that's important to know. Yes, you can take it with you, but will it be the best thing for you? And the only way to know that is to work with somebody in that market to understand why it would be good to keep or why it may not be good to keep. Now, you need to make sure that you're doing your own research because you don't want to just take someone's word for something blindly. The reason why I put education out the way I do is because I want people to be able to think for themselves, learn things, process information, understand complicated instances when it comes to Medicare, because that's the only way you're going to be able to really get the most out of your program, is to understand your choices. And then from there, you can make an educated decision on what you think is best for you. It's not a good situation where someone else is the expert and they're telling you what you should get. You should understand your choices, good, bad, or indifferent. Okay? But the only way to completely understand your choices is to be educated. And that's the purpose of this podcast. No one is doing a podcast like this. Nobody. There's other Medicare podcasts, but nobody brings you the level of information and detail that this podcast does, and nobody gives you as many episodes weekly, consistently, week after week after week after week after week, like we do. But that's why we do it, because I want to put the power in your hands. I want you to be fully capable and fully understand what your choices are, and that, folks, is when you'll be empowered to make a good decision. So, to refresh, Medigap's Medicare supplements, you can take them with you, but the price will adjust to whatever this price would be in that particular state due to your particular age. Okay? So, that's important to know. That can be a good thing or that can be a bad thing. It depends on where you're moving to. So, it's always important to look into it. You just don't want to move to one place to another and say, oh, Christian said I can take it with me, it's fine. You probably just want to check up on it, because for all you know, the insurance company you have your Medigap or Medicare supplement plan with could be dynamite in your state, but they might not be as competitive in another, and you might be able to do much better. You got to look at these things. Stay with me. Don't go anywhere. Segment 2's coming right up. Welcome back, everybody. This is segment 2 of episode 96 of the Everything Medicare Podcast. My name's Christian Brindle, and every single week I bring you 3 podcast episodes where I discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. Thank you so much for sticking with me. Thank you so much for listening on this wonderful day, this weekend on a Saturday. Okay? So, we're talking about moving. So, we talked about Medicare supplements and Medigaps, plans such as Plan F, G, and you know what I mean, the plans that are alphabetic. I've done so many episodes about Medicare supplements, I'm not going to explain what they are. If you're a new listener, go back and listen to some of those older episodes and previous episodes where I just dive right in to the nuts and bolts and, the guts and the glue of Medigaps and Medicare supplement programs, because those episodes are going to help you out a lot if you're a new listener. But we established how that works. It's pretty simple. You can take it with you, but the price will adjust to that particular state. So it's important to update it. Make sure that it's going to be the best price for you, because you don't know that market as well as you know your own. And particular insurance companies do very well in certain parts of the country, and they don't do very well in others. And so who's the most competitive in that new place you're moving to is going to vary. And that's why it's important to never fall in love with one particular insurance company. That's always been my motto. Never fall in love with one. And this podcast is actually on YouTube now on video. I'm being videoed now every time I do a podcast. We've been doing that the last couple of weeks. Very uncomfortable for me. I don't like that. But I'm doing it anyway because it was very highly requested. People always say, you're always wearing a t-shirt when you do these podcasts, and it always says a different insurance company name on it. Are you endorsing that company? Absolutely not. I wear a different t-shirt every time to show you that I don't have any loyalty to one or another. Like today I'm wearing an Aetna t-shirt. Aetna's a fine company. Are they the only fine company? No. Are they going to work for everybody? No. Are there situations that are going to be great? Yes. Are there situations that are going to suck? Yes. I wear a different, I have a different company logo stamped on my chest every time we do a video or a podcast to show you I don't fall in love with one or the other, or any of them in particular. My job is to fall in love with you, my customer, or anybody on Medicare particularly, and give you a perspective that's going to specifically tender to your needs and preferences, okay? So, we talked about Medicare supplements, easy. Let's talk about Medicare Advantage plans and Part D plans. So we'll talk about Part D first, because we'll use that same situation. If I have let's say I have a Plan G with XYZ insurance company, and I'm in Utah and I'm moving to Florida. Well, chances are I'm going to have a drug plan too, because Medicare supplements don't cover prescriptions. because Medicare doesn't cover prescriptions. What's the rule with a Medicare supplement? As long as Medicare pays first, the supplement will pay afterward. And Medicare A and B work together to provide a person medical coverage for hospital visits, surgeries, doctor's appointments, durable medical equipment, home health care, hospice care, rehabilitation, etc., 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 etc. So Medicare supplement works as a copycat insurance. It pays after Medicare. It supplements Medicare. Medicare doesn't cover prescriptions. Part D prescription drugs, meaning prescriptions that you get filled at a pharmacy and take home and take on your own. So neither does your Medicare supplement. So most people that have a Medicare supplement also have a drug plan. It's encouraged to have this drug plan because even if you don't take any drugs, because if you don't, our brilliant government penalizes you for not having a drug plan. And if you listen to me for some time, you already know this, but the penalty is ridiculous. The way it works is the penalty grows and builds for every month you've gone without drug coverage. And it doesn't affect you unless you decide you want drug coverage at some point in time. Most people need it at some point because statistically speaking, as you get older, you're going to have more of a need to take medications. It's something that we all face. And so not having that prescription coverage forever could be detrimental. So the way it works is the penalty builds for every month you went without it. And then whenever you decide to enroll, the penalty then gets added on to your monthly premium of your drug plan, and it stays that way for life. They will punish you for life, and the longer you go without it, the bigger the penalty is. So it's always recommended to have a drug plan. At the very least, take the cheapest available plan if you don't take any medications just to avoid that penalty. I don't agree with it. I don't like it. I think it's disgusting. I think it's the dumbest thing the government has ever done. But they do it anyway. You know, it's the opposite of freedom, in my opinion. Forcing someone to take a drug plan, even if they don't need it, is disgusting to me. But because of that fact, I'm not getting into a rant. That's not what this episode's about. Because of that fact, because the government does this, most people have Part D drug plans. So Part D drug plans are based off of your service area, meaning the state that you live in. In drug plans particularly, they're typically based on the state you live in. So you could move from one end of your state to another. You're probably going to be fine. You probably don't need to change the drug plan. It's going to be current in the state. But let's say you move from Utah to Florida, or Florida to New York, or from New York to California, or whatever, the drug plan will have to be changed. If you don't change it, after a certain amount of time, they will cancel your drug plan and you'll be left without drug coverage. They give you a window from your move. They call it a special election period. They give you a certain time period. Okay, I believe it's 60 days from the time of the move to pick a new drug plan. And if you don't, you get terminated on your old one, and then you have no drug coverage. So you have to change that one. Okay, you have to change that one. Now let's talk about Medicare Advantage plans. Medicare Advantage plans are a little bit more complex. Medicare Advantage plans, same thing as the drug plans. They're based off of a service area. They're based on where you live. However, the service area they're based on typically is not the entire state you're in. Whereas Part D plans typically are. They're going to be good anywhere in that state. They're going to work. The service area is the state, typically. But Medicare Advantage plans are usually a group of counties in that state, if not one county or two counties or maybe half the state. But typically it's based on certain counties in the state. I'll use my home state for an example. For those of you, if you've ever been to Utah, you know that you have southern Utah and you have the Salt Lake region. So the Medicare Advantage plans in the Salt Lake region are going to be different than Medicare Advantage plans in the St. George region. And if you move back and forth between those two places, even though you're within the same state, you're still out of the service area with the Medicare Advantage plan. So the same rules apply with a Part D plan. If you move out of the service area, and that doesn't necessarily mean moving out of the state. You could be moving to a different part of the state, and you could be out of the service area. Same rules apply as with Part D as far as the cancellation process goes. You have 60 days to pick a new plan from the day of the move. I believe it's 60 days. Don't hound me if I'm wrong on that. I just can't remember off the top of my head. It's either 30 days or 60 days. I believe it's 60 though. But I digress. You have that window. You have that time period to pick a new plan or you'll be canceled with the Medicare Advantage plan, same as the Part D plan. The only difference between the two is with the Medicare Advantage plan, the service area probably will not be your entire state. It's going to be certain counties. Whereas with the drug plan, typically it's going to be the whole state. Okay, so let's if in my situation, let's use the Utah example. If you're moving from Salt Lake City to southern Utah, which is closer to the border where I live, in St. George, we'll use that as an example. You're out of the service area, and you're going to have to change, or otherwise you'll be canceled and you're left with nothing. Well, just A and B, which I've always made a recommendation not to just go with A and B because the coverage by itself is poor to say the least. I've done plenty of episodes about it. Go back and listen if you're not familiar. But you get my point. Or, if you're in Florida and you're moving from Jacksonville to Miami out of the service area, with a lot of plans. Now, there are certain plans in Florida that the service area is the whole state. There are some exceptions to this, but with most Medicare Advantage plans, it's based on certain counties. So you need to be familiar with what your service area is with your Medicare Advantage plan before you move. And you have to know if you're going to be moving outside of that service area. And if you are, make arrangements to get a new plan. Don't go anywhere. I'll be right back for our third and final segment of the Everything Medicare Podcast. Stay with me. Welcome back, everybody. Thanks for sticking with me all the way to the end of this episode. My final remarks as far as moving is if you have a Medicare supplement, like I said in the first segment, my advice would be to make sure that once what the premium is going to be adjusted to, once you know what that is, make sure it's going to be the most competitive price you can get with a good insurance company. I'll be doing an episode Monday about ankle biters. And what ankle biters are is the lowest rates for Medicare supplement companies that come in and throw out rates that nobody can compete with. They reel in some customers by doing that, and then they can't sustain the price. They're companies typically you haven't heard of, or names you look at them and you're like, who's that? But typically they can't sustain the rates, and the rates go through the roof. We've had ankle biters in the Medicare industry forever. Okay, never ever can I recall a time where we didn't have ankle biters. But my point is you want to avoid ankle biters, and I'll be doing that episode on Monday, but make sure that you're getting the best price you can get with a quality insurance company that has a good rate increase history, number one with the supplements. On the Part D plans and the Medicare Advantage plans, if you're moving out of the service area, make sure you're on the ball on that. Don't get canceled, and then you're left without coverage until open enrollment. Okay? So just know, Part D plans, Medicare Advantage plans, if you move and you don't find a new plan, you'll be canceled. You'll be terminated. Folks, thanks so much for listening. Thank you so much for everything and all the support that you folks are giving this podcast and helping us reach more people and helping our message reach more people to help people understand something that really shouldn't be as complex as it is. Part of it is that the government just makes it overly complicated, but when you break down the information, it's not half as complicated. I hear people say all the time, well, that wasn't so complicated. It's because it needs to be explained in the correct manner, in the right terminology. And when it is, it's not so bad. But the government puts out rules that limit organizations like mine from putting out quality information. They really handcuff us on what we can say and what we can't say. So I'm always very careful about how I word things, but I try to do my best. But the government, in my opinion, I'm not one for conspiracy theories or anything like that, but you got to think they have a vested interest in keeping people confused, because why would they put rules out that limit the information that can be put out to the public, limit certain things from being able to be said, and make the information as confusing as possible for someone that's on Medicare? I'm trying to change that. We're trying to change that. You can help us reach more people and help more people all over the country by leaving us a review. Apple Podcasts, Stitcher, any platform that you might be listening to us on, please do us a favor. Leave us a review. and help us reach more people like you. You wouldn't believe how rapidly it affects us being able to be found by people that are looking for a podcast about Medicare, that are just looking for help. So it just mean the world to me if you did that and supported us. Okay. As always, folks, follow us on your favorite social media. Follow us on Facebook. I have a fan page, Christian Brindle. You can like and follow. I also have my company page, Christian Brindle Insurance Services. You can follow me on Instagram at Christian Brindle. You can follow me on YouTube, Christian Brindle, with an emoji cartoon face of me. That's what I looked like when I started. Not so much anymore. I've gotten a little older. You can follow me on LinkedIn, Christian Brindle. And as always, folks, if you're on Medicare and you're just confused and you just feel like you're not in the best situation for you, or you're just not sure, you're tired of not knowing. You're tired of not knowing if what you have is the best thing for you. Call my office. No cost, no obligation whatsoever. And we'd be happy to talk with you. I'd be happy to talk with you to see if we can maybe help you. We can't help everybody. Sometimes you're either in the best situation possible, or you're at a time period in the year where you can't change something. But nevertheless, we're always happy to talk with you. We can work with you. We're licensed in the states of Utah, Florida, Oregon, and Idaho. More states to come, but at the moment, those are the 4 states we're licensed in. So if you live in one of those 4 states, I encourage you to reach out to us if you feel like you need some help. Thanks so much for listening, folks. Have a great rest of your weekend. I'll talk with you Monday.